is at this point, someone came to him with the news that his daughter had died. There was another part of the plan that Jairus' daughter. Jesus simply told him to believe. The key is believe, and he longs to revive Jairus' daughter in similar fatherly tone as he said, "My child, get up." Now, what are we saying here today? The Father is saying, today I speak about giving and receiving. The leech had two daughters crying, "Give, give." There are three things that are never satisfied, yet four, and do not say it is enough. Proverbs 30 and 15. There's a spiritual law of success and law of giving and receiving is based on the fact that everything in this universe operates through dynamic exchange of reciprocity. Every relationship is one of give and take because giving and receiving are different aspects of the flow of energy in the universe. If we stop to the flow of energy, we interfere with nature's intelligence. We must give and receive in order to keep money or anything we want circulating in our lives. This is a touchy subject for many people to receive. However, it must be said. Currency, our word of money means to run or flow. Money is a symbol of life energy we give and the life energy we receive as a result of service we provide to others. Like river, wealth must keep flowing, otherwise it begins to clog and stagnate. Nothing goes out, nothing can come in. Circulation keeps it alive and vital. If we stop the circulation of life energy, if our intention is to hold on to our money and hoard it, we stop the circulation back into our lives. Discovery and Health is here to meet the needs of many people without any reservation. Dr. Berst gives freely time and information. At least anyone can do is give back to in return. Many come on the program and receive information. If not for yourself, you call for someone else. Many take this information and look for a shortcut. There are no shortcuts. The products and information can only come from Dr. Berst and him only. Your donations and offerings help to keep this program operating smoothly. Plus, the donations you give help those who are less fortunate, those who really cannot afford to give or buy the products that have been formulated by Dr. Berst. There are times when Jesus healed a person, he said, "Go show yourself to the priest and make an offering for your healing." In other words, pay it forward. These things must be said. I pray that no one takes offense. All is said in love to Lord. This ministry airs in many homes from four corners in this earth once a week, every Thursday for 52 weeks each year for the past 60 and present years. Whenever the collection plate is passed around, many do not give even when they have it to give and have received your healing, especially those who call on and at the 11th hour. Withholding not good from those to whom it is due is rightfully honest when it is the power of your hand to do so. Do not say to your neighbor, "Go and come again, and tomorrow I will give it," when you have it with you right now. When your friends come to ask you for a favor, why would you say perhaps tomorrow when you have the money right there in your pocket to help him today? Or should I say to help Dr. Truman? The intention behind our giving and receiving is the most important thing. When the act of giving is done with joy, when it is unconditional and from the heart, then the energy behind the giving increases many others and many times over. So the seed sown on good soil represent those who open their hearts to receive the word and their lives bear fruit, good fruit. Some year a harvest of 30, 60, even 100 times more than was sown. How if we give grudgingly, there is no energy behind that giving. When we believe that we have lost something through the act of giving, then the gift is not truly given and will not cause increase. Many hold money in their fists so tight that nothing comes in but a blessing so that someone else may be blessed in return. You are blessed. Everyone, according to as he purposes in his heart. So let him give not grudgingly on his necessity, For the Most High God, loveth a cheerful giver, and the Most High God is able to make all grace abound toward you, that you always having a sufficiency in all things, and may abound to all good work. So let your giving and offering become a sweet smelling fragrance, or sacrifice to the Most High God, which is well pleasing. He alone sees your heart. Click the donate button today. So be it.
So be it. Thank you, Prophet Elijah. Thank you so much. Did you have anything else to share before we go to the microphones and open them up for anyone who has a question, a topic, or a suggestion?
No, I'll just wait until you get into the flow, and then we'll see what the Most High wants me to get involved with.
Okay, all right, then we got a plan. Thank you so much again. And folks, please remember, Prophet Elijah will be joining us along the way, and especially at the end of the broadcast, where Prophet Elijah will be giving us another closing prayer, and then we will open up all the microphones and praise the Most High together. And now's the time when we ask anyone over there in the YouTube audience, or maybe Reggie or Micah, if there's a topic or a suggestion, let us know about what it is that you want to talk about. I'm looking for open microphones. I'm looking for chat rooms to open up over here on YouTube and over there with Reggie and Micah over there in Facebook. I don't see any microphones coming open at the moment. So please remember, along the way, as we continue our journey here for the next hour and 35 minutes, we will be looking for you to open your microphone and make suggestions, ask questions. All you need to do is press the star key 2 times on your telephone, and that means you have a question, a suggestion, something you'd like to talk about, or something you'd like me to talk about, and that's what we do. So there we are. And I'm looking at that. I don't see anyone there. I'm going to take a moment then before I get into tonight's topics: dry mouth, salivary glands, Sojourner syndrome. They're all part of the same thing. So we're going to be talking about that in a moment. But let's talk about the latest information coming out regarding natural remedies and herbs. Let's talk about the latest information. Did you know that these herbs, I'm going to move this over here so we can see it, and these herbs, the herbs like that are used in Ayurvedic medicine, there's herbs in Ayurvedic medicine that may contain a new drug against COVID-19. And according to the Deacon Herald, April 5, 2021, the results of a new laboratory study have associated glycyrrhizin, an anti-inflammatory compound found in the Ayurvedic herb multhi, which is also known as licorice. Licorice has the ability to reduce the cytokine storm and the severity, and severely impede, actually, can severely impede the replication ability of COVID-19. So, these are new studies that are coming out and finding out that licorice would be a great herb to stop that cytokine storm of COVID-19 from occurring. It severely impedes it. So know that. Also know that there's other studies, some new studies. There's a study that hints at Mediterranean diet slowing prostate cancer progression, and cancer, that was in Cancer Health, April 5. The data from the study of 410 newly diagnosed prostate cancer patients have linked the following: a Mediterranean style diet with a reduced chance of cancer progression, a result that warrants further investigation into the correlation. So what we're seeing here is correlation between diet and cancer, which is the reason why that I put together a diet system that I always ask people when they tell me that they have cancer. I ask them to get on that particular diet. And the reason why is because it follows Mediterranean diet principles, but a lot more. It's also alkaline, an alkaline diet. So there's a lot to that diet. It has nuts and seeds and all kinds of nutrients that build you up and make you stronger. And that's the kind of thing that that people are using, and they're reporting back that no matter what health condition they come to me in, whether it's cancer, high blood pressure, kidney disorders, when they get on that diet, things change. The reason they change is you're getting this high nutrition, this incredible amount of nutrition, and your body responds to it. So then when you're taking herbs to discourage various health disorders, well, then you've got this wonderful diet building you up and nourishing you, and then you've got all these particular herbs that are targeted to certain health disorders. It works. It's very simple. A good diet, special nutrients, and it works. But these are the kinds of things that the government doesn't want to talk about, because there's no money in it, and the government is aligned with the pharmaceutical industry because of all the money it gets from it. Once again, follow the money, and the pharmaceutical industry keeps you drugged up, keeps you so sick with one drug after another drug, and all these chemicals interfere with the normal processes of your body. And eventually on whatever chemicals they're giving you, you can't take them anymore. It comes to a point where they make you so sick you can't take them. And sometimes that's the way it starts. You start taking some of their chemicals and it makes you so sick you can't take them. And it happens all the time, and people are telling me this all of the time. So there's a lot of new studies coming out. Seaweed molecules found to aid wound healing. Seaweed molecules are found to aid wound healing. That's from the Medical Express, April 9, 2021. Scientists are investigating how Ulvan, it's ULVAN, Ulvan, which is a polysaccharide. It's found in green seaweeds, and it can facilitate the multicellular, multi-biomolecule 3D bioprinting process that is wound healing. Wound healing, it's all those things. And seaweed. And that's why every day I have a little squirt of Irish sea moss. It's one of the things I get every morning, a little squirt of Irish sea moss. It's a seaweed. And it gives you all of these wonderful nutrients that help in wound healing. It aids the process. Now, there's another study with curcumin. Curcumin is another name. Facebook, the shop commented on your post in an herbal, okay? Curcumin, that's another name for turmeric. Turmeric, curcumin, it's the same thing. Turmeric is the common name. Curcumin is the botanical name. And curcumin, turmeric, is a powerful, it is a powerful anti-inflammatory for knee osteoarthritis. Nutri ingredients, April 7, 2021. The data from a new clinical study shows that after 6 weeks of supplementation with curcumin, turmeric, and turmeric comes in a powder, turmeric comes in a liquid, it comes as an herbal tea, turmeric. The supplementation, it was a proprietary turmeric extract, but extracts are the most powerful form of herbal medicine. And and they gave it a name, BCM-95, and it's a registered trademark and all that. But it was able to significantly improve knee pain and stiffness that's induced by osteoarthritis. And an observation credited to curcumin's ability to, it looks like I have someone who doesn't have a key to the door. No, please don't bark. Please don't bark. I'm in the middle of the broadcast. I'm sorry. You need a key? I'll make sure you get one. Okay, thank you. All right. Okay, we're multitasking here. Somebody needed to be let in. They didn't have a key. That's all right. We let them in. We can do that. So what we're talking about here is curcumin that is getting rid of inflammation. But there's more to this because this is osteoarthritis. That means it's bone arthritis. And when you've got bone disorders, you want to take plenty of magnesium and calcium. And then you want to take something called betaine, because the betaine is going to unlock the calcium to where it gets to the bones. See, people are taking their calcium, but it's not getting there. It's getting trapped in the tissues on the way to get there. And because that's happening, it doesn't have to happen if you know about betaine. Betaine HCl, one with each meal. And if you ever have acidosis, acid reflux, you take 2 betaine HCl tablets with about 12 ounces of water. And in 10 minutes, you don't have acidosis anymore. You don't have acid reflux. That's how you get rid of acid reflux, is 2 betaine HCLs with a large glass of water. And in 10 minutes, it's gone. But what it's doing, it's breaking down the calcium so that it gets all the way through the tissues. And then there is no arthritis because you're getting that. And then, of course, then you need to look at, the arthritis report. And you're going to find that in that arthritis report on herbalhealthreview.com, that's exactly what I've been saying. Before they did the study, I already knew that the curcumin is a powerful anti-inflammatory, and you're going to see it's in all kinds of formulations, including my favorite formulation up there on herbalhealthreview.com, and under common conditions, under arthritis. You're going to see a formulation that that works for arthritis. It works very, very well. It's time proven. I'm clicking on the common conditions here, common conditions report, and I'm going to go down to arthritis, and we're going to take a look at that. See, I'm up in that herbalhealthreview.com website that's got all that information and hundreds of videos of me doing just exactly what I'm doing right here. And so you got all these videos, all of these reports, it's all up on this website. Let's go down and take a look at arthritis and rheumatism type disorders. And when I do, I've clicked on that now, and I'm going to bring that report over on top of this report so that we can take a look at that, because arthritis is horrible. And and there's so many people that have arthritic rheumatoid type problems. But as we get in here, we see the first thing that I'm saying is how about some green tea, because that's also very helpful for arthritis and osteoarthritis. And it's the polyphenols in the green tea, which they're also good against COVID-19, and they're anti-inflammatory. Green tea. Below that, there's turmeric. Turmeric is an extremely effective anti-inflammatory herb, and thus an effective pain reliever. It contains it contains at least two chemicals, curcumin and curcuminoids, which decrease the inflammation and are very much like oft prescribed non-steroidal anti-inflammatory drugs without the side effects. Turmeric, it's listed there. And then it's listed in a formulation that I created called Joint Care. Now, please understand, I don't sell products. I invented the products. I get nothing from them. I was threatened by the FDA in 2010. They said, you can't do this. You can't help people. You can't say all these things about these herbs. It's against our policy and against our rules. So you got to stop it right now or we will destroy you. That's the last day I got a paycheck from any of the remedies that I created. I created a ministry long before that because I knew that would happen one day, because that's what they do. That's what they do. They're bullies, and bullies do that. So the FDA, when they told me that, I said, oh, let me call you back. I never called them back. So I lied to the FDA. I never called them back. And I finally wound up in court, but I did exactly what they said. They said, you can't have that website. The website, where I published all my information. So I made sure that I didn't own it, and I still don't, but I still maintain it. And there's, see, it was against their rules that I could own a website. It's not against their rules that I could maintain a website with all that information. And anyway, I won that case because the FDA was told by the chief federal judge of the Western United States to leave me alone. Go after potato chip manufacturers and leave natural remedies alone. So anyway, we're talking about one of the greatest herbal formulations for pain and suffering of arthritis. And there below, that's the HCl. That's right. So it's all right in the arthritis report. What we've been talking about, it's in the arthritis report. But that Joint Care, let's open it up in a new tab. And I could do that. Open link in a new tab. And let's take a look at that Joint Care formulation, because it took about 56 different herbs and compounding them. It took me 7 years to get the combination perfect, because I used to have arthritis. I used to have so much pain, I couldn't move, and I was always sore, and my neck was sore, and so forth. But that's all gone because I used that Joint Care formula. Let's take a look at what's in the Joint Care formula. And what's in it is 56 different herbs, including turmeric, a lot of it, and a lot of herbs, and a complete formulation that we used to use for cancer, but they said you can't have an herbal formula for cancer. So that's against our rules. Everything's against their rules that would help you. You're supposed to either take a drug or suffer to death, according to them, and they stick by it, and they put people, and they harass people, intimidate people, threaten people, and they're just bullies. But and it's been going on like this since 1940. I was born a year later, 1941. But anyway, this is an incredible formulation that gets rid of inflammation and pain. And one of the key herbs in it is turmeric, but it's a lot of others, and they're balanced, and they're pain relievers, they're muscle relaxants, they're inflammation and infection fighters. It's an incredible formulation that even includes mushrooms. So so when we're talking about the study about curcumin, done April 7, 2021, that's what, 8 days ago. 8 days ago. So I already did that. I already knew that. And it's published, and it's been published, and people have been using it for years, for that formulation for about 15 years, 10 to 15 years now. Now, there's other studies. I'm going to do a couple more studies because all of this is really interesting, that they're all coming up with the answers I already came up with. New data supports the idea that phytochemical profile of cranberry extract determines the urinary tract infection or UTI, urinary tract infection benefits. Cranberry. Nutra Ingredients USA, April 7, 2021. A new research study published in the Journal of Dietary Supplements has discovered that a cranberry product produced from the juice inhibited superior anti-adhesion activity compared to a product made from whole cranberry. As a result, that signifies that the type of compound may influence effectiveness in regard to preventing urinary tract infections. In other words, cranberry, it's got a component and we already knew that. And if you look at my kidney bladder report, you're going to see cranberry listed there. So cranberry is for the kidneys, and there are a lot of other herbs. That's why we've got people who were on dialysis that came off of dialysis. Yeah, it took 3 months to 6 months, but they were off of dialysis, and that's miraculous. But we've got people who have had kidney disorders, including my sister. Whenever she has a kidney a disorder, for instance, she came to me about 6 months ago. She said, wow, I don't know what I did, but my kidney is down to 40%. The doctors are really worried and so forth. I said, do what you always do. Go to that kidney bladder report and take that marshmallow root powder, marshmallow root tea, and take that number 1246 kidney bladder herbal formulation. And so she did. 2 weeks later, she said, guess what? My kidneys are up to over 60% now. And the doctor said, how did you do that? And she said, my brother's an herbalist. That's how I did it. And she's an amazing story. They wrote her off long ago, and she's made so many comebacks. She's had pneumonia over 100 times. And every time I tell her how to get over the pneumonia with colloidal silver water, and she does it and gets over pneumonia, but she gets it again. She's got this low immune system, and but that's because she had a brain virus at the age of 12, and she had to totally learn to do everything. Had to learn to do everything. All at the age of 12, she went back to having the brain capacity and learning capability of an infant. And she had to start over again, and she did. And she's miraculous, and she helps children. She's taken many children into her home over the years and helped children that needed help. It's really a labor of love. I think it runs in the family. But food as medicine. Here's something that one of my favorite nuts is called a pecan nut. Now that's a nut that is full of fat. I mean, it's really it's for people who are underweight. I always tell them eat some pecans, get some pecans and eat bananas and eat pecans and avocados and all these things. So a food as medicine. Let's talk about pecan. The Carya, Illinois census, Juglin DCACA, and it was a study. This is by Hannah Bauman and Haley Royer, and they're talking about the pecan nut, which has earned its place at the table as an excellent source of antioxidants, vitamin E, and essential fatty acids. These are good fats. You need them. And modern research has linked increased nut consumption with lower levels of cholesterol and reduced risk of developing cardiovascular disease. So nuts are really good for you. I keep telling people, eat nuts, especially walnuts, but also here's pecans. And it'll reduce, and these nuts will reduce cholesterol, and they will help with heart disease, cardiovascular disease. And despite the pecan's high fat content, it is also shown to have a low impact on weight gain. So you don't gain extra weight, you just get the natural fats that you need to be healthy, and you go to your perfect weight with pecans. So it are consumed in moderation. That doesn't mean you can, polish off a couple of pounds of pecans. That's not going to work. But moderation in all things. But those are some things I wanted to share with you today. These are studies that are brand new, and yet it's the same thing. That I already did that research. I already came to these conclusions, and that's why that I invented 14,000 natural remedies in over 60 years now. So anyway, arthritis, rheumatism, that joint care formula is number 1043. Number 1043 joint care formula, and then get some of that betaine HCl, get lots of that extra turmeric, get some green tea. These are all things that are for osteoarthritis. And by the way, nettle with quercetin is wonderful to get rid of inflammation. There's ginger ginger root is as effective as ibuprofen, just as effective for arthritic pain and all kinds of pain. Ginger root, and it unlocks the mucus and gets the mucus out of the body. That's right. You got to drain the mucus out of the body, and ginger will help do that. White willow bark is the origin of natural aspirin. That's natural aspirin without side effects. You see, in 1700s, a French chemist he did research on herbs and came up with the fact that white willow bark is anti-inflammatory. So it's good for headaches. It's good for arthritis. So that was in the 17th century. In the 18th century, a German chemist, his father came to him and said, if you were really a good chemist, you'd make something for my arthritis pain. So the German chemist did some research, found that information about white willow bark. So he synthesized the white willow bark and made a drug out of it that became an acid, but it got rid of inflammation. It got rid of pain. But an acid, if you didn't chew those aspirin tablets up, they could get in your stomach and burn a hole in your stomach, because they're an acid, whereas the white willow bark is not an acid. It's just a well-balanced anti-inflammatory. So with this German chemist, he named his discovery Bayer aspirin, Bayer aspirin. And that's how we got Bayer aspirin. It really came from white willow bark, which was harmless. And then they made an acid out of it and sold millions and millions of dollars of it. Inflammation. There's an inflammation formula that has boswellia and turmeric together. The two together are more powerful than the one, either one being alone. And that's what you do. You combine certain anti-inflammatories together, then you really have a powerful inflammation formula. And there is an inflammation formula where those two are combined together, turmeric and boswellia. It's number 1208, herbal tincture extract. But fish oil is also good against, all kinds of inflammation. So it's wonderful for arthritis, and it's wonderful for heart health. So there's two things right there for heart health, and that's fish oil. So that's why every day I get some fish oil. Every day I get some fish oil. Oops, I need to go over there and do that again. Oops, okay, let's get back over there. Oh, what's that doing here? Let's get back into the room and see if we can get, there we go. So thank you, Reggie. Thank you, Micah. Thank you, Najee out there in, thank you for joining us there on Facebook. And thank you folks for joining us on YouTube. And thank you folks out there who are joining us over Uber Conference. We are live over Uber Conference. You can reach us by telephone and go into that room. You can reach us live over the internet on Facebook, and you can reach us live over YouTube. Now there are lots of things that are anti-inflammatory. You know, cat's claw, colloidal silver water. There's an emu MSM salve that works great. Burdock root is one of the all-time great herbs. And there's acidophilus. Now there's something a lot of people don't know about, and that is they don't know about a Japanese enzyme called VitalZem. VitalZem is such a powerful anti-inflammatory. It eats up scar tissue. A lot of people have scar tissue and they don't know what to do with it. Doctors certainly don't know what to do about it, but what to do about it is called VitalZem. The 3 times a day will be very anti-inflammatory. It will eat up scar tissue, and it will help all kinds of wound healing and any kind of bruising and so forth. VitalZem enzymes. But anyway, we got away from that. Let's get back. Let's get back over here and get to another topic that we wanted to. We've got a mic open over in New York. So I'm going to ask the person.
Good evening.
I'm going to ask the person in New York, would you please tell me what it is that you want to talk about in New York?
Okay, I just wanted to say, I'm allergic to aspirin. That triggers my asthma. So if I took the willow bark, would it do the same thing?
I would.
How are you, dear?
Probably not. But I would start, and I would start, and unless you have a particular, it's called salicylate, and if you have that particular allergy to salicylates, then whether it's in an aspirin or whether it's in white willow bark, if you have an allergy to that, then it's a problem. So I would test it by using the tiniest amount. I would get some white willow bark. I would get some white willow bark. I'm sorry. Hold on just a minute there. While I finish answering the question for this lady. So what you want to do?
No problem.
What you want to do with that white willow bark is get a 1 ounce bottle, just a small size, and then take about six drops. Take about 6 drops, And then you'll find out, and if you get any kind of allergic reaction, well, then, you know, then you know that you are allergic to the salicylic acids that are in
Okay, yeah,
that are in
so
it.
it's that and Motrin. Okay, and when you finish asthma is the topic. Okay, thank you so much.
You're welcome.
Mute me now.
You're welcome.
Okay, bye.
But there are also a lot of other things that you can use for inflammation, like turmeric and boswellia and nettles.
Yeah.
So there are a lot of anti-inflammatories, and you'll find those anti-inflammatories listed on the website herbalhealthreview.com under common conditions, under arthritis, and rheumatism. So okay, so that gets us going in that direction. Let's go ahead and grab, because I can't hear what Najee or Micah or Reggie, you know, if they have a question or a topic or a suggestion, you know, go ahead and let me know that now, because I'm looking at Facebook and I want to make sure that I know you're watching. And if you do have a question, let me know. But if you don't, let's continue. Let's talk about salivary glands. You know, the glands underneath your tongue that help you to produce saliva. Let's talk about dry mouth causes, and let's get into that topic, because that's one of the things that we need to talk about. So what causes dry mouth? And you know, did you know that digestion begins in the mouth? Let's start there. Digestion begins in the mouth, and that without proper saliva production, it can be difficult to. Let's bring this right over here on top of that. Okay, now we're looking. Now we're bringing it in front of the camera so that you can see what it is that I'm referencing. Saliva. That's digestion. That's a proper saliva production. It can be without a proper saliva production. It can be difficult to digest foods properly. Saliva contains two essential digestive enzymes: amylase, which breaks down starches, and lingual lipase, which breaks down fats. And it's aiding in digestion, and it starts right there in your mouth. Healthy adults produce 3 pints or so of saliva a day, which helps to moisturize the foods as we eat, making it easier to chew and swallow. When there's a lack of saliva, mouth irritation, gum disease, tooth decay, infections, bad breath, and poor digestion are all possible. Now, it is easy to see why dry mouth, or its technical name, xerostomia. That's right, xerostomia is the technical name for dry mouth. You got to take it seriously, you know, really. Dry mouth is a serious thing. Dry mouth occurs when your salivary glands don't produce enough saliva to keep our mouths wet. They got to stay wet. The mouth's got to stay wet. While often a normal side effect of aging, so as you're aging, you can lose that. It's a normal side effect of aging, xerostomia. And it can also be caused by certain medications and radiation and chemotherapy, all the things that the doctors do to people that are harmful. Medications, radiation, chemotherapy, as well as certain underlying health causes can cause this dry mouth. Treatment for dry mouth depends on the root cause. If it's caused by medications, you got to get rid of the medications. You got to change medications or discontinue medications. Try to find the natural remedy. Changing the type of medication or the dosage may help if you're having it, if if you don't want to use natural remedies and you're going to use drugs, you might have to change the certain medication you're on or change the dosage. Now, and that may help. And if it does, it's that, it's that medication causing it. If it is caused by an underlying health condition like diabetes, you could have, or something called Sjogren's syndrome. Sjogren's system, or diabetes, that'll give you dry mouth, and you need to be effectively treating the condition. Then you can get some relief. Fortunately, there are a number of natural remedies that may help to improve dry mouth symptoms. So what is dry mouth? Dry mouth is a condition when the salivary glands do not produce enough saliva to keep the mouth moist. Saliva is essential for digestion, to prevent infection in the mouth, to prevent gum disease, and to prevent tooth decay. Saliva actually helps to neutralize both bacteria and fungi in the mouth, making it essential for good oral health. You've got to have a wet mouth. In addition, having a dry mouth can cause a variety of other challenges. Foods may not taste like they once did. If you don't have the right amount of saliva, the foods don't taste right. And it may be difficult to chew and swallow dry foods. And xerostomia can impede speech. You can't speak correctly if you've got a dry mouth. A decrease in saliva is something that is more than just uncomfortable. It can lead to serious dental health conditions and poor digestion. Signs and symptoms of a dry mouth. You'd have maybe a sticky feeling in the mouth. Saliva is stringy and thick. Bad breath, difficulty chewing, difficulty speaking, dysphagia. Dysphagia is difficulty in swallowing. Dry or sore throat, hoarseness, dry or grooved tongue, burning mouth syndrome, change in taste, intolerance for salty, sour, or spicy foods or drinks, problems wearing dentures, lipstick sticking to teeth, dry or cracked lips, sores in the mouth, gum disease, and tooth decay. Dry mouth occurs when xerostomia occurs when the salivary glands do not produce enough saliva to keep the mouth moist. Saliva is essential for digestion, to prevent infection in the mouth and prevent gum disease and to prevent tooth decay. A decrease in saliva is something that is more, it's more than just uncomfortable. It can lead to serious dental health conditions and poor digestion, and aging, certain medications, cancer treatments, and underlying health concerns, including certain autoimmune diseases, can cause dry mouth. So the treatment for dry mouth depends on the root cause. In elderly people, dry mouth is a great concern as it makes chewing, swallowing, and digestion difficult. And this can lead to poor nutritional deficiencies and even pneumonia. Now, recognized signs of symptoms of dry mouth include, we already went over that, so we're not going to do it twice. Let's get to the causes and the risk factors. When salivary glands don't make enough saliva, dry mouth occurs. Recognized dry mouth causes and risk factors include medications for depression, high blood pressure, anxiety, as well as antihistamines, decongestants, muscle relaxants, and pain relievers can cause dry mouth. Aging. Aging is associated with dry mouth, which may be due to certain medications. Alzheimer's disease, inadequate nutrition, or other underlying health conditions when you're aging. And chemotherapy, drugs can change the amount and the nature of the saliva that is produced. This may be a temporary side effect, or it may be permanent. Radiation therapy directed at the head and neck can damage salivary glands like chemotherapy. The damage may be temporary or it may be permanent with radiation. Nerve damage as a result of an injury, trauma, or surgery can cause dry mouth. Diabetes can cause xerostomia. Symptoms and dry mouth is actually a symptom of undetected or unmanaged diabetes. That's right, you get that dry mouth could be diabetes. A stroke can cause dry mouth, and depending on the type of stroke and severity, the symptoms may be permanent. Oral thrush, a yeast infection in the mouth, can cause dry mouth. It can cause dry mouth symptoms. And it is often resolved when the infection is treated. Alzheimer's disease is related to xerostomia, and Alzheimer's Association indicates that it may be caused by inadequate fluid intake in addition to certain prescribed medications. In other words, you're not getting enough water, and certain prescribed medications are causing dry mouth when there's Alzheimer's disease. Sjögren's syndrome is an autoimmune disease that causes excessive dryness in the eyes and the mouth, as well as other conditions. And then there's HIV and AIDS causes dry mouth for many people. And HIV-associated salivary disease is common in diagnosed children. And in addition, many of the medications prescribed for HIV and AIDS are linked to dry mouth syndrome. Tobacco use, both smoking, chewing, can cause dry mouth. Quitting smoking relieves symptoms very quickly for some. Alcohol use including binge drinking and the use of alcohol-based mouthwashes can cause xerostomia. So if you got an alcohol-based mouthwash, it could cause dry mouth, xerostomia. Recreational drug use, particularly the use of methamphetamines, can cause severe dry mouth, commonly referred to as meth mouth. Meth mouth. Marijuana use can also provoke symptoms when smoked or vaped. In addition, the American Dental Association identified the following more rare causes of xerostomia in a report to the ADA Council on Scientific Affairs. Graft versus host disease. Immunoglobulin G4, sclerosing disease, degenerative disease, amyloidosis, granulomatosis disease, sarcoidosis. I made a complete sarcoidosis report, and which is listed in common conditions. There are very few sarcoidosis reports out there. There's not much information, but I gathered it all together and gave you my take on sarcoidosis. Hepatitis C will cause dry mouth. Salivary gland aplasia or agenesis, and lymphoma can cause dry mouth. Conventional treatment, well, many people ignore dry mouth. They ignore the dry mouth symptoms and don't visit their doctor or dentist as they see it to be just an uncomfortable condition. However, if it's left untreated, serious dental health conditions and poor digestion can occur. Diagnosis requires a full review of your medical history, including any medications you're taking, any past physical traumas to the head or neck, and any history of chemotherapy and radiation for cancer. Your physician will likely order blood tests and imaging scans of the salivary glands to look for the root cause. If Sojourn's syndrome is suspected, a biopsy may be taken to confirm the diagnosis. As dry mouth syndrome can cause serious dental health problems, it is important that your dentist be included in the treatment. Ideally, you should visit your dentist every 3 to 6 months, according to the American Dental Association. But I got a lot of issues with dentists as well. They use way too many drugs in their treatments, and they're chemical happy. Most dentists are chemical happy, so which I'm not so happy. And some dentists are pretty brutal in the way they stick you. They don't care, but some of them are really good. So hard to find a gentle dentist. Conventional treatment for xerostomia depends on the root cause. Finding an effective treatment to manage diabetes, for example, that's where then you'd go over to the diabetes report. Because when you go on that diabetes system, we have many people who don't have diabetes anymore. They say it takes about anywhere from 3 weeks to 1 month, and they just don't have diabetes anymore. This makes doctors really angry because they say there's no such thing as a treatment for diabetes. If you've got it for life. But that's a lie. Or they just don't know the truth. All right. Conventional treatment for xerostomia depends on the root cause. Finding an effective treatment to manage diabetes, for example, may be the first step if it is determined to be the cause. Your medical team may recommend other treatments such as over-the-counter oral rinses and mouthwash. Although I invented the greatest mouthwash that I've ever seen or used. And it's called Oral Care Refresh, Brush and Rinse. Go to the teeth report. The teeth report on Herbal Health Review, common condition, go down to teeth. You'll find the replacement for toothpaste. It's called Oral Care Refresh, Brush and Rinse. And it will strip the plaque right off your teeth. It will harden the gums, make your gums strong and tough. It will harden the enamel of the teeth. It will harden the entire tooth. And it works and will leave a very fresh taste in your mouth. You can brush your teeth with the Oral Care Refresh brush or just rinse. The most common pilocarpine needs to be used carefully, according to Harvard Medical School. This is a powerful drug. Pilocarpine is a powerful drug normally used in the treatment of glaucoma. And the best treatment for glaucoma is in the eye report on herbalhealthreview.com. If there's glaucoma, take a look at that eye report. Got a lot of people who don't have glaucoma or any kind of an eye disorder. When they find out about that, I report on herbalhealthreview.com. Become a member so that you can use that entire website and the hundreds of videos that are there, and all the reports, and an herb course where you can start learning about herbal medicine on that website. There's just so much information there. Anyway, according to Harvard Medical School, pilocarpine is a powerful drug normally used in the treatment of glaucoma. And it may help to relieve dry mouth, but it carries worrisome side effects, including limiting night vision and chronic inflammation of the eye. So why should they use it? Fluorine trays worn overnight to prevent cavities. Those are things that people are using, and fluoride will dumb you down. That's what they give to the Jews when they put them in the concentration camps. They would load them up with fluoride because it dumbs you down and you become complacent and will do whatever people tell you to do. So that's why some evil politician got fluoride into our water supply, so it would dumb us all down, so we would probably vote for the evil politicians. They use fluoride to prevent cavities. Horrible idea. So what is the oral microbiome? How do you balance the oral microbiome to improve overall health? Well, natural treatments: stay rehydrated, drink half your body weight in water, juice, tea, liquids. You've got to have half your body weight in liquids to properly take care of the kidneys so you don't lose them. That's right, you got to keep those kidneys flushed out. Yes, you got to go to the bathroom probably more often than you want to. And I have a lot of people who are on on dialysis. They told me, I just didn't have time to go to the bathroom, so I quit drinking water. And they wound up on dialysis for the rest of their life, unless they found out about the system that we use under kidney bladder, and they can come off of dialysis in 3 months to 6 months, most usually. Now, not everybody, but most of the people do. And at least their kidneys are stronger, better than they were ever before. So there is a kidney bladder system to keep those kidneys healthy. You want to stay hydrated. So drink enough liquids, and we can't count coffee or alcohol as a liquid. It's not a healthy liquid. Okay, you drink a little bit of coffee, 1 or 2 cups a day. It's actually good for you, for most people. Not everybody. See, everything isn't for everybody. Everyone is as different as your fingerprints. Everyone is that different. So nobody is the same. So if something works for somebody, doesn't mean it's going to work for you. Too much for somebody is probably just enough for you. Those are the things you need to know. But when you're drinking with meals, you want to help with the chewing and the swallowing. Drink non-alcoholic beverages with meals. Take some small bites and sip your drink as necessary to aid in the breakdown of food. Moisten foods with a broth. Avoid dried foods like crackers and other foods that suck up the little moisture that you have in your mouth. And add bone broth to help moisten drier foods, to make it easier to chew, swallow, and digest. It's also important to avoid salty, processed foods like potato chips, And that's what the judge said. The Chief Justice of the Western United States told the FDA to go after potato chip manufacturers and leave natural remedies alone. So potato chips, horrible food. No, you want to be careful of salty and processed foods that can make symptoms worse. You want to breathe through your nose, not through your mouth. There are a lot of people that are mouth breathers, and that'll dry up your mouth. Anyway, breathe through your nose, not through your mouth. One of the most common dry mouth causes is breathing through your mouth instead of your nose. When exercising, limit breathing through your mouth as much as possible and sip water throughout your workday. If you snore, try natural snoring remedies to help keep your mouth moist. Use a humidifier. If you've got dry mouth, use a humidifier and put it by your bed. Put it by your workspace. The Cleveland Clinic recommends using a humidifier to increase the overall humidity in your home. Be sure to fill it every night before bed. And if you have a humidifier with a diffuser attached, make up a batch of diffuser friendly essential oils and sleep aids. Use colloidal silver water in that humidifier to get rid of pneumonia within 2 days. No more pneumonia within 2 days when you use colloidal silver water in your humidifier. And you might want to add a little bit of eucalyptus oil. That works very good for opening up the respiratory system. Use coconut oil on your lips. Dry and cracked lips are common with dry mouth. Apply coconut oil to your lips several times a day. Try coconut oil pulling. Coconut oil pulling can treat many of the symptoms of dry mouth, including bad breath and tooth decay. A number of studies show that this traditional Ayurvedic practice can improve overall oral health and decrease the microorganisms that cause bad breath. Also, there's one study that points to the lauric acid in coconut oil helping to decrease the plaque on your teeth. When practicing oil pulling, remember not to spit the oil down the drain. Instead, spit it into the trash can. Eat saliva producing foods. Snack or organic apples. You want to snack on organic apples and cucumbers whenever your mouth feels dry. Their high water content can help to relieve the symptoms of dry mouth. In addition, if you add fibrous foods that require a lot of chewing, like raw carrots, can spur saliva production. Certain herbs and spices, including cayenne pepper, fennel, ginger, and endive, have been shown to increase saliva. Add them to your diet whenever possible. Practice good dental hygiene. Floss. Use that oral care refresh brush and rinse. Brush your teeth with it. Rinse your mouth with that oral care refresh at least twice a day. A joint study from the researchers of Stanford University School of Medicine at Kyoto University School of Medicine, and Kyoto University School of Medicine and Public Health found that toothbrushing should be encouraged, particularly for those taking certain medications, as dry mouth in elderly can lead to pneumonia. Dry mouth in elderly can lead to pneumonia. Then you got to find out about that colloidal silver water and putting it in a humidifier and breathing that all night long and all day long. And in 2 days, no more pneumonia. Use only alcohol-free mouthwashes, as alcohol dries the mouth. Effective natural mouthwashes are available. Plus, you can try again, my homemade mouthwash, which is called Oral Care Refresh, Brush and Rinse. It's on, you'll find that Oral Care, you'll find that on herbalhealthreview.com under common conditions, under the teeth report, And I want to say hi to Minnie out there in Facebook. Thank you for joining us. And whoops, and let's see. I want to make sure I get back there. and thank you very much for joining us over there on Facebook and on YouTube. So we got some final thoughts here. You know, dry mouth symptoms can persist. They can cause poor oral dental health, conditions like gum diseases and tooth decay. In addition, without adequate saliva to combat bacteria and fungi in your mouth, because that's what the saliva is doing. It's balancing, giving you that, getting rid of bad bacteria and fungi in your mouth. Saliva is doing that. And it helps get rid of infections, including oral thrush, that are possible things happening in your mouth. As digestion begins in the mouth, if salivary glands aren't producing enough saliva to properly break down fats and starches, poor digestion can start right there in the mouth. In the elderly, dry mouth is a great concern because it makes chewing, swallowing, and digesting difficult. And this can lead to poor nutritional deficiencies and pneumonia. And my final thoughts are that dry mouth, or xerostomia, happens when the salivary glands do not produce enough saliva to keep the mouth moist. Aging, certain medications, cancer treatments, and underlying health concerns, including certain autoimmune diseases, can cause dry mouth. Conventional treatment depends on underlying cause of the xerostomia. Changing medications and treating disease like diabetes it may help. Looks like we've got a couple of open microphones over here. Let's find out. Over there in New York at area code 646, did you have a question, a topic, a suggestion? In New York? I guess not. Okay, we're going to close. Go ahead. What is it you wanted to talk about?
Asthma.
Asthma. You want to talk about asthma?
Yeah.
Okay, let's.
Yeah, because
Go ahead.
I had tried the congestion formula, the colloidal silver, respiratory formula, but it's still, I don't know.
Asthma.
It's still not
You want to look at the diet. You want to look at the diet. Get to that make lifestyle changes diet. If you've tried some of these but let's take a look at asthma because there are a lot of people who have asthma. And so let's get over there to the report. We were looking at arthritis and we looked at the joint care formula. Now let's go over to get out of here. Going to common conditions on the website, herbalhealthreview.com. Okay, I'm on common conditions and I'm going A, B, C, D. Hey, there's A, there's anemia, there's asthma, bronchitis, hay fever, and the respiratory system is all under the asthma report. Asthma. And asthma is caused by the spasms in the smooth muscles surrounding the bronchi and the bronchi and bronchioles. And these are small airways in the lungs, causing the passageways to partially close. The spasms are accompanied with increased mucus, which clogs the bronchi. So you got to get more ginger in the diet to move the mucus. Okay, so you got to drink a lot more ginger tea. Put ginger on your food because it's going to move the mucus, which is going to slow those spasms down, and it's going to slow down the asthma because this mucus is clogging the bronchioles and the bronchi, and it worsens the asthma attack, and it's
Yeah.
triggered, and it's triggered.
Yeah.
Go ahead.
Yeah, the ginger messes up my stomach because I have gastritis and umbilical hernia. So the ginger I have to drink very little.
See, so you're not getting the ginger because of other problems. So we got to work on those other problems so that you can get more ginger. So because you got to move this mucus out of the body, and you're not able to get the ginger to move the mucus because it will, but you can't do it. So we got to work on the gastritis and anything else that's preventing you from getting more ginger. So that's part of the problem, and then we got to really watch that diet and mucus forming foods like dairy. Be no dairy, no cheese. That would make the problem worse. So there's let's back up here. So asthma is triggered by an allergic response and the immune system producing the immune system produces histamine. Thus, any type of allergen can precipitate an asthma attack. It results in difficulty breathing, especially exhalation. The exhalation is slowed down, coughing, wheezing, and a tight chest. So asthma is specifically known as bronchial asthma. Cardiac asthma is the result of a heart malfunction. When the heart is involved and there's asthma, that's a heart malfunction. The respiratory system consists of the lungs and a series of associated passageways leading into and out of these passageways. The upper respiratory system includes the nose, the throat, and associated structures. The lower respiratory system includes the larynx, the trachea, the bronchi, and the lungs. The term respiration refers to the overall exchange of gases between the atmosphere, blood, and cells in your body. Cardiovascular system transports the gases in the blood between the lungs and the cells functions between the lungs and the cells. The functions include to supply oxygen, eliminate carbon dioxide, help regulate the acid-base balance of the body, increase nutrition, detoxify, and strengthen the body. Then asthma will leave if you can do those things. So yes, so you need to really use a lot of colloidal silver water.
Yes, it has.
especially humidifying it and breathing it.
Yeah, yeah,
So, and you want to make sure you're taking acidophilus capsules.
yeah.
There's a good one. It's called 1050. You can get it from Health and Herbs, and I don't get anything from the sale of any products, including those at Health and Herbs, which are products that I invented. I get nothing from it. So,
Mhm.
so we're talking about making sure you get acidophilus, and they got one of the best ones, 10 different strains and 50 billion strength. That's powerful. And because you need a powerful bacteria in your stomach, and you need to use colloidal silver water for over a period of time. And if you've used so much colloidal silver water that you are turning blue from the silver water, which can happen, you start turning blue, that's when you've gotten too much. Then you want a good heavy metal detox. And thank goodness I invented one called heavy metal detox. And you take that and it sucks up all of the heavy metals, like colloidal silver water is a heavy metal, but it's not harmful. Now, mercury, lead, aluminum, those are heavy metals that'll kill you. But this colloidal silver water that is a heavy, that has silver particles in it, which are heavy metals, can accumulate and will load up in your body, and then you need to get rid of them. So then you need to find, but people don't know what to do. So I do. It's called heavy metal detox. You get a heavy metal detox, you get some of that number 1078 colon and liver cleansing liquid. Every spring, every fall, you do a detox. You clean up the blood, the digestive tract, the colon, with that number 1078, making the bowel movements so soft that they break up in a cloud when you flush the toilet. And you take enough of that fiber powder to thicken the bowel movements so that they're not runny, and you balance it out to where you're taking fiber powder, which is absorbing the heavy metals and even from the silver water. And it pulls them into this number 4837 fiber powder that has bentonite clay, and the clay acts as a sponge and sucks all the heavy metals. It actually pulls it right into the clay. The clay is magnetic, and it pulls the heavy metals into the clay. And it's pulling the heavy metals into the psyllium seed husk powder, and it's pulling the heavy metals into that super green food that we put in there as well. All of them are detoxing you and getting rid of heavy metals. And you do that every spring, every fall, you do a detox. Now, and that's going to help the digestive tract. The herb cat's claw helps to clear up the respiratory problems. And you can get it in a spice flavor. But that 1078 is listed right here in the asthma report. And you're going to take maybe 1 or 2 tablespoons a day to keep the bowel movement soft. You may take 1